while I have quite a few microneedling videos in which I highlight the differences between medical needling and cosmetic needling, it is still a subject I get the most questions on when it comes to microneedling. Not only is there some confusion around the benefits of either one and how often either one can be done, but also which cartridge to use for cosmetic needling versus medical needling, which products can be used for cosmetic needling versus medical needling, and so on. So I thought it might be helpful to do a side-by-side comparison. I am going to cosmetic needle one side of my face and medical needle the other side, while in-depth talking about the differences, benefits, which cartridge to use, which products to use, and which ones not to use, frequency for either one, and so on. Hopefully answering all your questions. All right, I double cleansed my face and neck, and my hands are clean. I'm going to start cosmetic needling this side of my face. Cosmetic needling is not gory at all, and there won't be any blood. However, when I get to this side of my face, when I medical microneedle, there might be the slightest bit of pinpoint bleeding. If you do not like the look of blood, you might just want to listen to that part of the video. I will put timestamps down below in the description box. But before I get started, I have to give you my usual disclaimer. I'm not a medical professional, I'm not an esthetician, I'm not a microneedling expert. I'm just sharing with you what I personally do and what I have done for the past, I believe, 17 years now. However, if you're thinking of doing your own microneedling at home, please do your own research. With that said, like I said, I'm going to start with cosmetic needling, and I'm going to cosmetic needle this side of my face and neck. Now, in case you're wondering what is on my forehead, I saw a dermatologist yesterday for my full body check, my yearly full body check, and she froze off a couple actinic keratosis spots, precancerous lesions on my forehead. Luckily, I had nothing on my body, but while I'm really good about wearing sunscreen daily now, rain or shine, I didn't used to be good about it when I was younger. I used to be a sun worshipper. So this is old sun damage coming out now. I'm going to, of course, be careful around this area. But I'm going to use the same device for cosmetic needling and medical needling, just to keep it simple. And I'm going to use the BioPen Q2, which seems to be the doctor pen I reach for most times now, especially when I medical needle, because I find it to be the least uncomfortable when it comes to medical needling. However, to be honest, when I cosmetic needle, very often I will use a roller just because it is so much faster. So I can cosmetic needle using a roller, a stamp, a doctor pen, or any other microneedling device. I have a 28 pin cartridge right here, which I'm going to pop onto my device. I always use a fresh cartridge, whether I medical microneedle or cosmetic needle. That is, of course, if I cosmetic needle using a doctor pen. But the one thing I don't like about this pen, it is super sensitive. So just the slightest touch will turn it on. But the reason I always use a fresh cartridge is, first of all, I don't have to worry about sanitation. And secondly, I don't have to worry about whether the needles are nice and sharp. Now, if I use a roller, then I will sanitize it very well after each use, and I will replace it after every 10 or 15 uses. Now, let's talk about which products can be used for cosmetic needling. In my opinion, cosmetic needling is mostly for product penetration. Cosmetic needling uses a needle length of 0.2 to 0.3 millimeters. So tiny, tiny needles. At that needle length, we pierce the stratum corneum, the outer dead layer of the skin, and we barely enter into the epidermis. Now, since these tiny needles barely enter into the epidermis, I don't have to worry so much about what to use before, during, and after cosmetic needling. Technically, I could apply any serum I would like to penetrate just a bit deeper. Now, personally, I wouldn't use, for example, a glycolic acid serum, But I could use vitamin C, such as ascorbic acid, or even tetrahexadecyl ascorbate. I could use copper tripeptides. I could use growth factors. So again, since these tiny needles barely enter into the epidermis, and cosmetic needling is mostly, in my opinion, for product penetration, technically again, I could use any serum. I want to penetrate just a bit deeper. Lately, for cosmetic needling, I have actually really enjoyed using the Calism Professional Serum. I have changed my mind about this serum. I used to really not like it because of the way it smells. It really stinks. But I started using this regularly for cosmetic needling last year. Sorry, Beanie is making some noise in the background. And I really liked what it did for my skin. I'm going to apply some to these lesions as well. So I have continued using this for my cosmetic needling sessions because, like I said, I really like what it does for my skin, but I still don't like the smell, but I'm just dealing with it. All right, so I like to apply my serum before I cosmetic needle. I could also apply it afterwards, but I like to apply mine before I needle. I have my pen dialed in at 0.25 millimeters. Like I said, cosmetic needling uses a needle length of 0.2 to 0.3 millimeters. So I have this dialed in at 0.25 millimeters. Now the BioPen Q2 does have added modalities, which honestly I think are a bit gimmicky. It uses EMS electroporation, or it has EMS electroporation, which I never use. And it also has blue as well as red LED. I usually turn it on to the red LED, but I think it's really gimmicky because the light is in contact with my skin for mere seconds. I don't think it'll do much, but since the pen has it, I will use it. Now I have a mirror right here, so if I'm not looking at you, I'm looking in the mirror. But what I like to do is I like to start at my jawline and I put the pen to my skin just for a second or so in a stamping motion. So basically, the needles are too tiny, you won't be able to see it. But basically the needles jut in and out. So I am, like I said, applying this just for a few seconds, allowing the needles to jut in and out maybe once or twice. And I'm moving it along in a horizontal fashion, a horizontal way, setting the pen right next to where I just was. And I'm going to cover my whole face, going up horizontally and down vertically. I'm sorry, Beanie is playing in the background. Hopefully that's not too annoying. I had to get up and remove a cable. Beanie is such a good little girl. She listens really well. She doesn't really chew on anything anymore. She's still a baby. She's 14 months now. But usually she listens really well. But when I don't pay attention to her, when I'm on the phone, or when I'm filming, which she probably thinks I'm on the phone, then she wants to get my attention. So that's when she starts being a bit obnoxious. She tries to find something to chew on to get my attention. So it's a little challenging to be on the phone or film. She will usually calm down, but I had to just get up and remove my charging cable from my ring because she wanted to chew on that. She never, it's always out. She never chews on it unless, like I said, I'm on the phone. And again, this, she thinks I'm on my phone because I film on my iPhone. So she probably thinks I'm doing FaceTime. But you can see I'm getting a bit of erythema, a bit of redness. But there is zero pinpoint bleeding because I'm only barely entering into the epidermis. But what is happening right now is that we are letting or allowing the Calism serum to penetrate just a bit deeper into the epidermis. I'm going to take my fingers and very carefully, and I'm going to look in the mirror to do that, very carefully pull down the skin under my eyes a bit because I don't want to needle past the orbital bone, but I want to get just a tiny bit closer to my lash line. So there are some microneedling experts who do believe that cosmetic needling is also for collagen and elastin production. To me, that doesn't quite make sense because collagen and elastin fibers are found in the dermis, not in the epidermis. So since we are barely entering into the dermis, it doesn't make sense to me how cosmetic needling could help with the collagen and elastin production. But again, I'm not a microneedling expert. I might be completely wrong, which is why I'm saying that in my opinion, I think it is mostly for product penetration. So I've already covered this whole area horizontally, and you can see I definitely have some nice erythema. Now I'm just going to do the same thing vertically. All right, so I'm done with my cheek. Now I am going to do my chin. Personally, I like to section my face off the way I'm doing it. Doing my cheek first, then I do my chin. Usually I do, of course, the whole chin. And then I do around the mouth and the forehead. Around the mouth and the forehead are the most uncomfortable, especially when it comes to medical microneedling. Now at 0.25 millimeters, there is no discomfort. Now some of you have asked me, can you do the lips? Personally, I do my lips sometimes. I'm not going to do them right now because I do have some blistex on there and I don't want to needle that into my lips. But when I cosmetic needle, I often do go over my lips. I don't when I medical needle. I do personally find that that's a bit too deep. But at 0.25 millimeters, I will oftentimes go over my lips. I'm going to do the same thing on my forehead. I do like to go over my eyebrows because I do feel it helps them grow a bit. Like probably everybody else in the 90s, I overplugged my eyebrows and they have come back nicely, but I would like them to be just a bit more bushy. All right, I am going to do my neck off camera, but I am done cosmetic needling this side of my face. So again, I have some nice erythema, some nice redness, but no pinpoint bleeding. Now we're going to medical needle the other side of my face. I'm going to change my cartridge. I have a, where is it? 9-pin cartridge right here. Now for cosmetic needling, I used a 28-pin cartridge. Now I'm using a 9-pin cartridge. Obviously that is a lot less needles. And the reason for that is that while I dial the depth of penetration in on the pen, I want my needles to penetrate deeper since I'm now medical microneedling. Medical, I can't get this cartridge out of here. Medical microneedling uses a needle length of 0.5 millimeters or longer. At that needle length, we again pierce the stratum corneum. This pen is so finicky. It turns on so fast. It's so sensitive. This touchscreen is so sensitive. But at that needle length, at 0.5 millimeters or longer, we again pierce the stratum corneum, the outer layer of the skin, and we go through the epidermis into the dermis. So at 0.5 millimeters, we are barely entering into the dermis. Of course, with longer needles, we are going to enter deeper into the dermis. In the dermis, we find collagen and elastin fibers, as well as fibroblasts. And this is why medical microneedling is also known as collagen induction therapy. Because when these needles enter into the dermis, they create a controlled injury. The body heals this controlled injury through a cascade of reactions, which eventually lead to more collagen and elastin production. But since these needles penetrate into the dermis, I have to be really careful about what I use before, during, and after medical microneedling. Because I want to make sure that whatever I put onto my skin before, during, and after medical microneedling is okay to penetrate into the dermis. So for example, personally, I wouldn't use vitamin C, such as ascorbic acid. First of all, that would probably really sting. But there was also a study, a small study, but regardless, which showed that when vitamin C was medical needled into the skin, caused granulomas. I also wouldn't use something like this, which has quite the list of ingredients, some beautiful ingredients, but I'm not sure if all of these ingredients are okay to penetrate into the dermis. So personally, I use products which specify that they are okay to be used for medical microneedling, such as, for example, again, the Cosmetic Professional Serum, or I can use some high molecular weight hyaluronic acid, or something like this, like an NAD booster. These products specify that they are okay to be used for medical microneedling. If I'm ever doubting if a product is okay, I would rather not use it. So I, like I said, have double cleansed my face and neck. But for medical needling, I have gotten into the habit of using some hypochlorous acid before I needle. Some people like to use alcohol. I don't like using alcohol on my skin. It does a number to my skin. But I do feel the hypochlorous acid does a nice job to just cleanse my skin again and taking anything off and that shouldn't be on there, and I don't want to medical needle into my skin. All right, I also have some alcohol swabs right here, because when I'm going to touch my face in a little while, I'm going to wipe my fingers first with alcohol. Now, just like when I cosmetic needle, I like to apply some product to my skin when medical microneedling. Technically, I don't have to apply anything because I use a stamping technique, so I don't need any slip. In the past, I did tiny little circles, and when I did so, I used high molecular weight hyaluronic acid for slip. Again, since I use a stamping technique, I don't need anything for slip. But I like to apply some products, usually, which promise to help with collagen and elastin production, so I get a bit of a double whammy. Since I already have this open, I am going to use the same serum to medical needle. Now, the Cosmetic Professional Serum can be used for medical needling. In fact, it is often used in clinic for medical needling. This is not sterile. I opened this earlier, but these actually come in sterile little packages. So if that is a concern of yours, if you medical needle, I'm honestly not concerned about using a sterile product when I medical needle, because I'm not in a sterile environment. There are some bacteria floating around in the air. This, having been opened an hour ago, doesn't concern me. But if it is a concern of yours, these do come in little sterile individual packages. So you could just open this right before your medical needle, if this is what you want to use. I can't talk anymore. But anyways, let's get started. So I dialed this in at 1.5 millimeters. As I mentioned earlier, medical microneedling uses a needle length of 0.5 millimeters or longer. Personally, when I medical microneedle, I change the depth of penetration depending on the area I work on. So usually I will go 0.5 millimeters on my forehead, 1 millimeter around my mouth and my chin, and often 1.5 on my cheeks, because they are a bit sunken in here and I just find it a bit harder to get to this area. So that's why I go a bit deeper. So right now I have this dialed in at 1.5 millimeters. I don't ever go deeper than 1.5. I'm going to turn this on and I'm going to do the exact same thing. I am going to turn this on the red LED and then a medium speed. And again, I'm going to start at my chin, and you can probably tell that the pen makes a bit more noise. Now, as far as technique, I hope you can hear me okay. I hope this is not too loud. But as far as technique, as you can see, whether I cosmetic needle or medical needle, I use the same technique. That is, of course, if I use a pen. As I mentioned earlier, sometimes or very often when I cosmetic needle, I will use a roller just because it is faster. and I do cosmetic needle once a week. Now, medical needling is something I only do every 4 to 6 weeks. Because as I mentioned earlier, we create a controlled injury. The body needs time to heal this controlled injury and to produce collagen and elastin. So I need to give it that time, which is why I only medical needle every 4 to 6 weeks. So while the technique is the same for cosmetic and medical needling, if I use a pen, frequency varies quite a bit. I cosmetic needle once a week, I medical needle every 4 to 6 weeks. Depth of penetration is also of course different. Where I went 0.25 millimeters for cosmetic needling, I am now having these needles penetrate 1.5 millimeters. You can see again I'm getting some nice erythema and maybe just the slightest bit of pinpoint bleeding. I'm going to rest this for a second so you can actually hear me. Hopefully this wasn't too loud the whole time I talked. But once I get to the orbital bone, I stop. I do want to get a bit closer to my lash line, just like I did over here, but not at 1.5 millimeters. That is way too deep for under my eyes. So I will dial down the depth of penetration. But I covered this whole cheek horizontally. Now I'm going to do the same thing vertically. I'm going to speed through this because I am worried this is a bit too loud, and I will talk once I'm done with this. Alright, so I have my cheek covered horizontally as well as vertically. There is definitely a bit of difference as far as erythema. I'm definitely much more red over here. And again, I have just the slightest bit of pinpoint bleeding. I am going to dial the depth of penetration down to 1 millimeter now for around my chin and my mouth. Alright, I have it at 1 millimeter. And I like to make these faces to keep the skin nice and taut around the chin. Now at 1 millimeter, I am not going on my lips. I didn't go on my lips earlier either, like I said, because I have some blisters on there. But when I cosmetic needle, often I go on my lips, but not with this needle length. Personally, I think that's a bit too deep for the lips. But I will get very close to the vermilion border to hopefully treat my lip lines. And then again, I'm going to do the same thing vertically. Alright, chin is done. We are going to do my least favorite part, which is the upper lip. Now technically I could use numbing cream. Let me put this down for a second. Technically I could use numbing cream to make it a bit more comfortable. Personally, I don't like to use numbing cream because first of all, I have quite a high pain tolerance. Now this doesn't feel great, but I can handle it. But also numbing cream to me is just another step. I would have to make sure to wash it off really well because obviously I don't want the numbing cream to penetrate into the dermis. So personally, I don't use numbing cream, but technically I could. I just again would have to make sure to really wash it off well so that it doesn't get microneedled into the skin. But I'm just going to talk this out. All right, and that's done. In German we have a saying, wer schön sein will muss leiden, which translates to he or she who wants to be beautiful has to suffer. There's something to that. Okay, I'm going to do my forehead now, and I'm going to dial this down to 0.5 millimeters. And again, I'm going to go over my eyebrow. So again, as far as technique, whether I cosmetic or medical needle, if I use a pen, it's the same technique. The difference is the depth of needle penetration, which I of course dial in on the pen itself. And I also use a different cartridge for cosmetic needling versus medical needling. For cosmetic needling, I used a 28 pin cartridge, which to my knowledge is the cartridge with the highest amount of pins I can get for the BioPen Q2. For medical needling right now, I'm using a 9-pin cartridge. Let me put this down for a second. Now, the reason I'm changing the number of pins in the cartridge for cosmetic needling versus medical needling is that when I medical needle, I want those needles to penetrate deeper than when I cosmetic needle. This is where it gets a bit confusing, because obviously I choose the depth of penetration by dialing it in on the device itself. However, having fewer needles does help the needles penetrate a bit better than having more needles. And what helps me is to think about a bed of needles, right? If I, with my bare foot, step on a bed of needles, it's not going to be too comfortable, but those nails won't penetrate into my foot. However, if I step onto just one nail with my bare foot, and that nail is going to penetrate right into my foot. Similar concept. Even though I dial in the depths of penetration on the pen, it is helpful for medical microneedling if I want deeper penetration to have fewer pins, and if I want more shallow penetration for cosmetic needling to have more pins. I hope that makes sense. Alright, I am done with my forehead. I'm going to now dial this in to 0.25 millimeters, and I'm going to clean my hands real fast, or my fingers real fast, with this alcohol swab. Let this evaporate. And now I'm going to do the same thing I did on the other side. I'm going to just gently pull down here. And again, I'm going to try to get a bit closer to my lash line without going past the ocular bone. So this is my whole left side of my face, medical microneedled. Again, you can see there is definitely a bit more erythema, I can't talk anymore, and some pinpoint bleeding. So again, I went 0.5 millimeters on my forehead. So there is not that much difference on my forehead. As you can see, I went 0.25 here, 0.5 here. I went 1.5 on my cheek, again 0.25 here, so quite a difference. And then 1 millimeter around my lips and my chin. So again, as far as technique, if I use a Dr. pen, same technique for cosmetic needling as well as medical microneedling. However, for cosmetic needling, I want to use a different cartridge than for medical microneedling. Again, for cosmetic needling, I want to use a cartridge with a higher number of pins. For medical microneedling, a cartridge with fewer pins. Of course, depth of needle penetration also varies. Again, cosmetic needling uses a needle length of 0.2 to 0.3 millimeters. Medical microneedling uses a needle length of 0.5 millimeters or longer. Now, because the depth of needle penetration is different, outcome is going to be different. Again, in my opinion, cosmetic needling is mostly for product penetration because we are barely entering into the epidermis, versus medical microneedling, which again is also known as collagen induction therapy, helps with collagen and elastin production. So outcome is different. Frequency varies. Cosmetic needling can be done quite frequently. Personally, I cosmetic needle once a week, versus I only medical microneedle every 4 to 6 weeks. What I can use before and during is different. Aftercare is different. So right now, this side of my face is basically healed. These tiny little puncture wounds I created are closed. So if I wanted to, I could apply the rest of my skincare, and I usually do. Beanie is not liking something she's seen outside and she's growling, but usually I cosmetic needle in the evenings. So I will apply my retinoic acid afterwards without any problems. If you have sensitive skin, you might not be able to do that, but I have no problems at all applying retinoic acid after cosmetic needling. If I cosmetic needle during the day, I will apply sunscreen after. Now this side of my face is a different story. The puncture wounds I created over here are going to take a bit longer to close than the ones over here. So even after medical microneedling, I have to be really careful about what I'm applying. Ideally, and that's usually what I do, I will just continue applying what I used during my medical microneedling session. And then tomorrow, when I go outside, I will apply sunscreen on this side of my face, on both obviously, but also on this side of my face. But I usually use a mineral sunscreen containing zinc oxide, because not only is zinc oxide non-irritating, but it is also healing. So aftercare is different, and of course recovery is different. You can probably see some of this redness is already going away. Now I do have reactive skin, so I do stay red a bit longer than maybe some people do, but this redness will be gone in a couple of hours, versus this side of my face will stay red for at least a day, even longer sometimes. So recovery is also different. And then the only other difference I can think of is discomfort level. This cosmetic needling to me is not uncomfortable at all, versus medical microneedling, especially around the lips, can be somewhat uncomfortable. And also you can get some pinpoint bleeding with medical microneedling, versus with cosmetic needling, you don't. So I hope this video was helpful, and I hope it answered all of your questions. If you have any more questions, of course, please leave them down below. Always love to hear from you. Any other comments, please leave them down below. Thank you so much for being here. Until next time, bye.